Hey guys, it's Dr. Jake Gies here with Flex Forward Physical Therapy. Been getting a lot of interest about this question, and it is the 3 tips to fix your neck pain. So, what I want you guys to know is kind of the progression of how you go ahead and seek your treatment for your neck pain. A lot of people will end up going through and talking to their doctor, and then finding out, that they maybe then need to go to therapy or a chiropractor or whatnot. So my tip number 1 is start at a physical therapist. And the main reason why is that we are trained to specifically look and evaluate, multiple regions of the body, and the neck being one of them. And we can determine whether the pain is associated with your joints, your muscles, or your nerves, or any other tissue going on in there. So you're going to, by doing that, you're going to kind of miss all of the other runaround that you're going to go through otherwise. So normally the path would be to go to see your primary doctor. They'll most often give you muscle relaxers. That may help if it's a muscle issue. Otherwise, if it's a joint thing, that might not help at all. So you're just kind of wasting time and money. So the best option is to start with a physical therapist, and they are going to be able to pinpoint what's going on. And usually just by listening to what you say, there's specific words, keywords that we're looking for, and we can tell you right then and there like what's going on just by you saying maybe 3 words. So start with a physical therapist. That's tip number 1. Chiropractors, and this is going into tip number 2. Chiropractors, they can do evaluations, they do those x-rays and everything. However, most of their treatment, usually, not always, is going to be like a manipulation. That can be effective as treating neck pain in specific, types of neck pain. So once again, the nerve, muscle, joint, it kind of depends on what's going on there. So chiropractic can be effective in those things. However, it might not be a long-term effect. So really, to keep the long-term effect, we're looking at needing more exercise-based medicine. So the combination of manual therapy or hands-on techniques and then the exercise is really what's going to give you that long-term relief as far as your neck pain goes. And to be completely honest with you, I'll tell you a little bit of personal story about me. My main thing is I have neck pain, and that's kind of also why I started Flex Forward Physical Therapy. I wanted to treat primarily neck pain and back pain, is because I really suffered from neck pain to the point where, and this was in grad school, I was going to grad school for physical therapy to get my doctorate, and at this time I was in Utah in my first clinical, and I had, neck pain, but also I was just getting numbness and tingling down my arms to the point where I was actually losing function in my hands and my shoulder, and everything like that. Pretty scary, and I didn't know what to do. And knowing, going through school and kind of knowing what to do, but also my instructors, who were all physical therapists, my teachers, and the clinicians I was learning from in the clinic, they were able to look at me, give me treatment, give me exercises, and now I don't have any of the numbness, tingling, or weakness on my left side at all. So I'm a little biased, but it's really effective as far as short-term relief and long-term relief if we're using hands-on techniques and we are using with exercise. It's the number 1 evidence-based research for it. Medications are not strong for it, and then manipulations can be effective in certain cases. Now, the third thing is I want you to continuously try to change positions and manage your stress levels. So technically there's 4 total tips there. That's 2 tips right there. So 1 is changing positions regularly. So a lot of times we just sit in one spot and we might have forward head, right? So what we want to do is throughout the day really try to challenge ourselves. Sometimes we can just get lazy and look to the left or right with our eyes, but trying to rotate our head all the way through a range of motion, tipping our head, this is one that most people don't do. That one's really great to help keep your neck mobile and not get stiff, okay? And then the other one was managing stress. This one's really important. So most people are going to have neck pain due to muscle tightness, not always, but sometimes. And muscle tightness usually is associated with the upper trap, so that's going to be the muscle that connects from your ears kind of to your shoulder joint. And that muscle is really influenced by your stress levels in life. So if you notice you're getting more neck pain, it might be because you are more stressed out. So managing that stress is really important to bring your pain levels down. So if you start doing deep breathing, meditation, yoga, even just periods of just sitting in silence in the dark or listening to music, singing, those are all things to stimulate the vagus nerve and help bring relaxation into your life, and then those stress levels will come down, and also possibly your neck pain if it's associated with, stress related muscle tightness. So those are the 4 tips. We gave you a lot of information there, but really that's the kind of the step-by-step process of how I would tell someone to reduce their neck pain and seek treatment for it. I hope that helps. As always, if you have any questions about this, feel free to reach out to me personally. You can send me an email. Otherwise, you can come in, set up a time to schedule with me for a one-on-one visit, and we can work on your neck pain. All right. Thank you. Have a good day. Take care. Bye-bye.